Okay, first I want to again thank you very much for joining me. And what I'm going to attempt to do is just give you some bullet points for our new product, which is Megacidin. And this is a cooperative effort between the Biocidin Company and Microbiome Labs. And I think it's perfect timing for what we're having to deal with today, because we really need to have a quick, acute immune boost so that people are more protected on some of our surface mucosal membranes. And that's what this product is going to target. So we know that our NALT, which is our nasal lymphatic system, our MALT on our mucosal membranes, and our GALT are all connected. So if we don't have good upper respiratory mucosal membrane health, then we're going to sabotage our gut microbiome health, because all of this works together. And we know that we've got pathogens that we are up against, that we're breathing in, that are coming in through our eyes, our mouth. Everything that's open to the world is an entry point for pathogens. So we want to really focus on those mucosal membranes and keeping them healthy. And this product is going to be one that you can carry around with you. You can use, it's going to give you a boost in your secretory IgA very quickly. And it's something that I think will be a good prevention against invaders, that we're dealing with, because much of our population is frightened. And I think we just need to provide tools that are really effective. So some of the bullet points on here, we know that this product is targeted for the upper respiratory tract. It's a combination of Biocidin and two of the Microbiome Lab spores, the Bacillus subtilis and the Bacillus clausii. It's going to support the buccal immune system. It targets 700 different bacteria, including those that cause gingivitis, the strep and the Veillonella. It's also going to help support against COVID, SIBO, and dysbiosis. So the way it works, and kind of the jingle that the company has come up with, that we want to have legit spit. We realize that our saliva is important, and it needs to be a benefit to us and not a liability. We produce 600 milliliters of saliva, and it has a lot of those immune properties, such as beta defensin, which is a peptide that's released from our T lymphocytes. And this is, again, when you look at how our immune system works, secretory IgA is really like the cops. It's what apprehends the suspects and brings them to the interrogation room. The M cells, or the microphage cells, are more or less like the interrogation room, and the beta defensins are like the firing squad. So all of these work together to apprehend suspects and to keep them under control. So the Biocidin is going to help with the IgA part of it, and the spores are going to help with the beta defensins and the M cell part of it. And that's how they work together. There's good clinical studies to show that the Biocidin increases secretory IgA by 66% in 10 minutes. So you see, it's a really good acute support that you can carry around with you in a spray bottle. And then the immune system is going to be maintained with the spores. So I think this is going to be more tools in your tool bag to add to the support for microbiome, not just the gut now, but now we're expanding through the entire gastrointestinal tract, starting with the oral cavity as well. So that is the end of my little spiel about Megacidin, and I wanted to open it up to the floor and see which of you have had experience with Biocidin by itself, and what do you look forward to as far as applying this new approach?
Yes, I have used Biocidin before for my intestines, you
Mm-hmm.
know. 5 years ago, I used the first time and I was very debilitated. Then I just used one drop. It was in liquid in that time. It was the only that they used.
Mm-hmm.
And I was very reactive, but my body only support one drop. And
Mm-hmm.
I continue with that one for a while until now. I could say that I hold between 7 to 10 drops, depends. Always, never, I continue, I do some treatment, I stop, I continue, I stop. Uh, but I feel the benefits. I'm very happy with this one
Mm-hmm.
because, I think that the people need it. I just, is oral product, is an oral product that you need to put in your mouth.
Yes, yes, it's a spray bottle. In fact, I have a bottle. Hang
Ah,
1 minute and I'll get my bottle.
yes.
Okay, so this is the product itself. You can see it here.
Mm-hmm.
So it's in a spray bottle format, called Biocidin, and I've just been trying it out. So it's the typical, few squirts. And I think the idea is that you want to use it preventatively. So if you're going into an area that you're unsure of who's there, if people are coughing and sneezing and wheezing, that's when I would use it just as an added protection. I know, everyone has their different opinion about the masks. Um, N95 means that it's only 95% effective. And that's if you use it, you change it out every day. So the basically the material masks that are handmade and some of the blue masks, that they're really not effective at all if you're really trying to uh, prevent a virus. So we really need more effective tools when we're around actually sick people. So I think tools like this are going to be very helpful because you can carry it with you and just use it in acute situations.
I was thinking if we are traveling, we can use two because we
Absolutely.
go to change,
Mm-hmm.
countries, we go to the aeroplane, sometimes
Right,
people is coughing a lot there.
right.
And I could say in that way, how many uh, drops or how many Sprite do we need to use? One or two or more?
Yeah, it says 3 sprays is the dose, and you can
Okay.
use it, every 4 hours if you're actually sick. You can use it through the day. You wouldn't use it prophylactically all the time. You just want to use it, when you're traveling, when you're sick, when you're going out into public, so that it's more effective when you do use it.
Mm-hmm.
Because remember,
All right.
it's giving
And
you,
one thing,
sorry,
that's a combination of the kind of antibiotic and probiotics, right?
yes, it has an antimicrobial effect as well as the probiotic. And the focus is on what it's doing with the immune system. Um, but it's increasing that secretory IgA very quickly. And that's the primary acute preventative strategy that you want to use.
All right. Okay. Mm-hmm. Sounds good. Sounds a good product, I'm going to try that one.
Yes. And it's one of 3.
So I have some questions.
Sure.
In terms of ragweed, like with the allergies right now, would it possibly help people have a proper immune response with that?
I think it would help. I don't know, I don't think there's any studies on actually inhalant allergies, but allergies are complex. You know, you've got an initial mucosal response, and then you also have a systemic response. So I think this is going to definitely help with that initial mucosal response, and then how you're caring for your gut is going to help with the systemic. So I think we should try it out and see.
Sounds good.
So what I was saying too is that this is one of 3 products that they're going to roll out. And so they have a more comprehensive immune support plan that will be coming. Probably in November, you'll hear more of the other 2.
And going to be the combination of the 2 companies too?
No, I think this is the only one that involves the Megacidin company. The other ones are more antiviral in nature. You know, I think
Okay, so next question I have is for all the autoimmune or cases where, like, you know, the 80% of the time when people take the Megaspore, they'll have a fine response, but then the 20% don't.
Mm-hmm.
For those 20%, will doing something like this cause a bad response?
I think it's too early to tell. On some of those very sensitive individuals,
Mm-hmm.
It could be that they will respond better to an oral application like this, because I think people are sensitive in different areas. We're not going to really be able to predict until we try it, but it could be that, you know, the hypersensitive individuals are more sensitive to gut die-off than they are to local mucosal membrane die-off.
Interesting.
That's been my experience dealing, you know, with hyperactive children and autistic children, that they don't tend to be sensitive everywhere. You know, the body kind of balances out. So that's why we would, instead of doing a lot of gut protocols, we would try to use more transdermal, more, you know, mucous membrane, you know, sublingual. We would look for other areas of, you know, transmission to avoid the oral route, just because they didn't seem to be as sensitive in these other areas, fortunately. Now, I can't say that's going to be for everybody. It just seems like sensitive individuals don't tend to be sensitive in every route. Just, you know, if you're using the oral route and that's where you see the die-off with Megaspore, I think as we expand our product line, we're going to have other transmission, other ways to introduce products, just to avoid some of those issues.
For example, like a Megaspore cream.
Correct. A cream. Now we are working on a vaginal cream. It doesn't have the spores in it at this time, but it's an advancement just because they have found that interrupting, you know, the vaginal microbiome with some of the products that OB-GYNs are currently using can interrupt certain individuals temporarily and some permanently. So they found that just changing the lubrication is a step in the right direction. So, you know, they're trying to look at all the microbiomes throughout the body and see what improvements they can make. but know that we've talked about this in some of our other, nerd meetings. When you look at, doctors like Klinghardt, he has posted online some of his protocols, and he has protocols for almost every orifice in using Megaspore, whether it's, spraying it up the nose or putting drops in the ears or taking a bath with it. The idea is, again, you've got quorum sensing that all of these microorganisms have, and just having the spores in a certain environment changes the environment.
In terms of that and spraying it on the back of the throat, or well, when I read the bottle, it says back of the throat. Is it supposed to be the back of the throat, or can you just get it in your mouth?
I suppose the idea, aiming for the back of the throat, is just going to cover more surface area. So that would be the optimal. But as you know, working with all sorts of different patients, that if all you can do is just get it in the mouth, that's a step in the right direction. Sometimes that's where you have to start.
Yes.
And it's the same with.
All right. Now with the spores themselves, do you know if they are going to be able to attach to the back of the wall and do something? Or are they going to be like the Megaspore that we take now? If we just put it in water, they go in and then go into the large intestines and then become active.
Right. Yes. My belief, through their quorum sensing, their ideal environment is the intestine. So they will have an effect because their quorum sensing, ability in the mouth is going to change the environment there, but their optimal effect is going to be when they get to the gut.
Okay.
Good questions, though. I think when a new product comes out, we have to look at it in all sorts of perspectives and different type of patients, from infants to the elderly, and because you're going to get every question under the sun. So the more things we can consider and kind of talk about now will help us kind of formulate our description or our presentation to people so that they understand the power of it.
Okay, so in terms of some of the Megacidin ingredients, such as the white willow bark, I know that's what aspirin was made out of, or chemically made up from. What I notice when I use the Megacidin, my whole throat, it almost feels like it swells. And I wonder if that's just because of the blood vessels opening up. Would that be a true-ish statement?
Okay, well, if we think how aspirin, or what's the active ingredient of aspirin? Is it salicylic acid? If it is a vasodilator, yes. You'd have to help me on the pharmacokinetics of that. I forget, but if it's a vasodilator, then that certainly makes sense that you would have kind of a opening up vasodilation feeling.
Okay, I don't remember if it's vasodilator. I do know that it's a blood thinner.
Okay. Now, that does bring to mind, there is a contraindication for anybody that has a sensitivity to black walnut. The product does contain black walnut. So if they have a nut allergy to walnut, then it would be contraindicated. And I suppose there are some people that are sensitive to aspirin. You know, I think all of that is, you know, kind of an open field for anybody that has individual ingredient sensitivities that you want to consider. Maybe there is a reaction going on. And it could be how much can you tolerate. Maybe as the immune system is improved, maybe that reaction will just go away.
That's interesting. So basically, we're going to have to make sure that the patient reads the ingredients list and make sure that they're not allergic to any of those ingredients.
Right, right. And, you know, some people may not know if they have a reaction. Some people may be willing to try it, just a titration using a small amount, because as we've learned, sometimes these sensitivities will resolve as the immune system gets stronger.
Okay, so you mentioned that it might protect against COVID. Is that just because of the increase in the IgA?
Yes, so we're improving the immune system of the mucous membranes, and all of that is going to be real important for anything that is environmentally, you know, any environmental exposures such as a virus.
Okay, and I'm sure that the product or the microbiome company wants us to say, now, this is not going to protect you against COVID. This just might help because this helps or has shown through the research that it stimulates the immune system.
Exactly. Liability-wise, as you know, you really can't say anything.
Okay, I think that's all the questions I have. In terms of the application, like the spray bottle, I do know that there's another company that I have that does a spray bottle. They have a long stick where you can spray it and then it gets better into the mouth versus this one kind of gets on the outside of your mouth. Is there something that I could do in terms of recommending, hey, could we potentially switch to this type of spray device?
That's good. I haven't heard that, and I think all good recommendations should be taken in account. I will get that to the company, because again, they're still open-minded enough to consider making changes and improvements, and we appreciate that.
Sounds good. I will take a picture of it and then send it to you so you have a picture.
That will help. I appreciate that. Okay. All right, well, I'm going to take the video off and align here.